Good morning, friends. Today, as a academic lecture series, we are starting a lecture series on philosophy and medicine. This lecture series involves various aspects of philosophy of science, and various aspects of philosophy of medicine. In this lecture series, we are trying to deal with various topics in medicine, in surgery, in clinical medicine, in clinical surgery. But not only limited to that, we are trying to make this lecture series in philosophy as well as science point of view. The main purpose of this lecture series is to create the awareness about the interconnections in between the subject philosophy and science and scientific branches also. There is a misconception in the minds of many students that philosophy is different and science is different, and philosophy and science does not have any communication with each other. Or maybe in the educational system, it might not be taught to the students. And while studying sciences or various scientific branches like the physical sciences, like the chemical sciences, material sciences, or the medical sciences also, so as to go into the roots of that particular problem, so as to go into the in depth, or so as to survey the problem in depth, or so as to find out the solutions in depth, we need to have a proper philosophical background. Because philosophy deals with the roots. So that is the reason philosophy is the mother of all sciences, may it be any science. And this is the reason in this particular lecture series, it will be tried that we can have such interdisciplinary dialogue in between the various scientific branches as well as the dialogue between the philosophy and the scientific branches. And as a part of this series, we are starting it with the certain aspects of philosophy of medicine in today's session. Medicine as a branch has a long history. In the entire world, if you see the history of the entire world, whenever the civilization started existing, whenever the civilization started progressing, then at that particular moment, there was evolution in the branch medicine, depending on the area, depending on the countries, depending on the continents, where the civilization process started progressing. So whenever we say it is the Indian medicine, so this is a system of medicine which developed in the Indian subcontinent over a long period of time, or over many centuries, and it has a long history. When we say Western medicine, then it is routinely considered as a modern medicine. So I just want to clarify certain things, that whenever we say that it is a modern medicine, somewhere it will be close to the Western medicine. Whenever we say that it is a Indian medicine, it is the Ayurveda system of medicine, Ayurveda, Yoga, Siddha, etc. And there are certain complementary systems of medicines like the acupuncture, acupressure, and other systems which are worldwide available in various parts of the world and getting practiced also to certain extent. Normally they are called as the complementary systems of medicine. So generally they are referred as the complementary or alternative systems of medicine. Now, exactly where the word philosophy stands in medicine. or where medicine stands in philosophy. What is the connection in between both of them? Do we really need to study philosophy when we study medicine? These are certain basic questions. Because it is very difficult, I do not say it is not existent, but it is very difficult to see in the routine curriculums that the students of medicine are well versed or are properly taught the philosophical subjects, and this is the reason it is in the minds of many doctors that there is not such any communication in between philosophy and medicine. But when we do research, when we look at the problem, when we look at the subject in depth, then we find that the philosophical ideas, the philosophical concepts have due importance in the progress and evolution of medicine. Now, the word medicine, the journey of medicine in ancient sciences, in ancient Indian system, has its own process. The journey of medicine in the Western system, Western medical system, has its own process. In different perspectives it developed. There are various contributions from various people, various scientists. The ancient India, those there were rishis, like the rishis like Charaka, rishis like Susruta, rishis like Vagbhata. The rishis, or we can also call it sages, like Bharadwaja, Punarvasu, Dharmantari. These all sages have put forth certain concepts, and this particular scientific branch, which is called as Ayurveda, which is also called as Indian system of medicine, has been developed over a period of centuries. You can find the ancient Samhitas, the ancient text. Samhitas is the word which is used for the ancient text, and these texts are written 3000 years before, whenever there were very less advances in physics, chemistry were available. So the medicine as a branch is developed before 3000 years in the ancient India, and by means of various disciples, the tradition of medicine continued in various parts of the India, and still that tradition is rich. You can see many parts of India, many parts of this country, that this tradition is still strongly in use. People use Ayurvedic medicines and with fantastic results. If any science is not having any such strength, then how can it survive for millenniums? How can it survive for so many centuries? It does mean that that particular science has a strong base, and that strong base is theoretical also and the practical also. You can see that even for 3000 or 4000 years, there is no any change which has happened in the basic concepts which are given in the ancient Indian medicine, and now also when Indian medicine is being practiced in this particular country or even worldwide, while treating the patient, these particular basic concepts are used, and you won't feel that there is a strong requirement to change the concepts. Means on the basis of those concepts, when the patients are getting treated, that is, those are getting cured, it does mean that the concepts are valid. The concepts are, if the concepts would not have been valid, then how the patients will get cured? No. When the patient is getting cured, it does mean that the concepts are valid. Now, this validity of the concept every time cannot be determined on the parameters of the modern sciences like physical sciences or the chemical sciences, because there is a basic philosophical difference in the understanding. If we look at the history of Indian medicine, we find that while developing this particular science, the ancient sages, we can even call the scientists also, ancient scientists, they have taken the proper help from the people from various sciences, various other sciences, or from the sciences which are also called as the darshanas in the Indian context. So these are the darshanas like Sankhya darshan, Vaisheshika darshan, Nyaya darshan, Yoga darshan, Mimamsa, etc. So by adopting certain concepts in these particular darshanas and by properly applying it in human being and developing a science, that science is called as Ayurveda. So the concepts from other darshanas like Sankhya darshan, like Vaisheshik darshan, has been adopted. There are certain derivations which are done. Those derivations we call as the derivations from biological point of view, and later by deriving certain concepts, certain foundations are laid down, and on the basis of those foundations, we can call it as axioms, we can call it as theorems also. There is a difference between axioms and theorems. We can call something that the axioms, we can call something that theorems, and on the basis of that, a biological system is defined, and by means of those fundamentals, a system is defined where the patients will be treated on the basis of those concepts. This is the beauty. Means first laying of the concepts, putting the concepts, creating the foundations, creating the concrete foundations, and after creating the concrete foundations, deriving certain more things, define a particular biological system, and that biological system will work for the care of the patients, for curing the patients. And there is not only the curing of the patients, there is one more thing which is told as swasthasya swasthya rakshanam. It is told in Sanskrit, swasthasya swasthya rakshanam. Swasthasya swasthya rakshanam means taking care of the healthy person, to preserve the health. The motto is preserve the health. And next they tell about aturasya vikara prashamanam. This is in Sanskrit, aturasya vikara prashamanam. And aturasya vikara prashamanam means to cure the diseased. This is the motto. And whenever they call about what is meant by health, see, now if you look at various definitions of the health, we say it's a disease-free state, something like disease-free state. So we first say about disease and then we say it is a disease-free state. But it is not told in that way in ancient sciences. They have told prasanna atmendriya manaha swastha ityabhidhiyate. It is also a Sanskrit quotation. I will just elaborate it. Prasanna, Atma, Indriya and Mana. So they are first considering Atma, Atman. Then they are considering that Indriyas, so Jnanendriyas and Karmendriyas, there are 5 Jnanendriyas and there are 5 Karmendriyas, and Manas, mind. So when Atma, Indriya and Mana is prasanna, in a happy state. Prasanna is a happy state. If your state is not happy, you are not fit. You are not first. When your Atman, your Indriya and your Mana is not Prasanna. Prasanna stands for happiness. And when all these three are in a state of happiness, then it is called as swastha. It is not a disease-free state only. It is not just a disease-free state. It is something more than that. It is prasanna, atma, indriya and mana. So whenever you examine any patient, whenever you examine in fact any person, you should see whether the person is having the prasanna atma, prasanna indriya and prasanna mana. It is not only the disease free state. See the conceptual difference. See the difference of understanding. And if you find that the person is not having the prasanna mana, you have to treat. You have to find out the solution for it. If you find that the person is not having the prasanna indriya, you have to find the solution for it. Indriyas, to a certain extent, we can call it as the sense organs. And prasanna atma. Now, it is very difficult. Atma, what is meaning of atma in modern, as per the modern science? Consciousness can be a term, slightly synonymous we can say, but it is not completely the same. Atman does not mean exactly consciousness, what I personally feel. Consciousness is a some part, it is a some, to a certain extent, some translation which we can use for Atman for practical purposes. Means, whenever you consider as a human being, you have to consider the Atman in that. And very interesting fact is that when the human embryology has been described in various chapters, the chapters are called as these thanas. There are ancient texts, mainly Charak Samhita, Susruta Samhita and Bhagavad Samhita. And in those ancient texts, which are supposed to be the main texts of Ayurveda, in those texts, there is a division of various thanas. So like Sutra Sthana, Sharira Sthana, Nidana Sthana, Chikitsa Sthana, Vimana Sthana, Kalpas Sthana, Siddhi Sthana, etc. These sthanas are the combinations of various topics related to a certain concept. So, Chikitsa stands for the medicinal treatment, Sutra stands for the basic concepts, Sharira stands for the anatomical and physiological considerations. So, while describing the Sharira Sthana in these ancient texts, they have specifically mentioned that the embryo forms when the Atma enters. The embryo forms when the Atma enters. And it is along with this Atma and the Pancha Mahabhutam. I am going to come to the Pancha Mahabhutam. So, this in total, as its effect, creates a unit, creates a fetus. Such kind of considerations we cannot see in modern medicine. They look at it in a different way. The understanding is in a different way. Means, when we look at the patient, I will use both the terms, patient as well as the person. So, first we see person and then we decide whether he is a patient or not, or whether she is a patient or not. Immediately we cannot say that he is a patient or she is a patient. We have to see as a person. And when we see that particular person and when we examine, then we can decide whether he or she is a patient. And here, while examining the particular person, we have to see the Atman also. Means a different vision is required. Nowhere the modern medicine tells that you should be able to see the Atman of the person. No, it is not there because the concept is not there. But as a physician from ancient Indian medicine, you should be able to feel that whether the person is having the prasanna atman or not. That's the metaphysical aspects. These are the metaphysical aspects. And metaphysical aspects every time cannot be judged by means of only objective parameters. We normally call two types of parameters, subjective parameters and objective parameters. So these words are very commonly used in the research methodology. So the subjective parameters or the objective parameters which are there. So when we talk about the metaphysical aspects, it is very difficult to find out, or it is very difficult to define such aspects in objective parameters point of view. And in subjective parameters point of view, if something is metaphysical problem in that particular person, then what the subjective experience the person is getting, or even if the person is not having any symptom also, the physician should have a different way of understanding, or we can say a different vision by which the physician can analyze that this particular problem is a metaphysical problem. So if we see the classification of the diseases in ancient Indian medicine, we find Adi Bhautika, Adi Daivika and Adhyatmika. If we compare it to the modern medicine, they say organic, psychosomatic. Organic, psychosomatic. But Adi Bhautika means somewhere nearby, I can say that, related to the disease of the organs or systems. Adi Daivika, somewhere it goes to metaphysical, close to metaphysical, and Adhyatmika, that is also close to metaphysical. And this is a classification. Means it is not only the organic diseases, not only the Adi Bhautik, you have to look at the Adi Daivika as well as the Adhyatmika diseases. And Adi Daivika and Adhyatmika diseases needs a different metaphysical understanding of disease. And this is one very important philosophical concept in Indian medicine. So, while treating the patient, while diagnosing the patient first and then treating the patient, first of all you should be able to define the problem is Adi Daivika or whether the problem is Adhyatmika or it's a combination of all, combination of Adi Bhautika, Adi Daivika, Adhyatmika. Then you have to classify properly and then you have to put the treatment pattern, that what I am going to do for this Adi Bhautik problem, what I am going to do for this Adhyatmika problem, what I am going to do for this Adi Daivika problem. So means every time the medicine should not be something like a herb or something like a kalpa, means certain drugs. So every time treatment does not involve giving the drug therapy only. So what we normally feel that treatment means either giving the drugs or doing the surgeries. But it's not to every time. Whenever it is necessary, we have to give the drugs. In Indian medicine, these are called as the Kalpas Formulations. There is a separate subject which is called as Dravya Guna. There is a subject in modern medicine which is called as pharmacology. It cannot be it is not exactly the same pharmacology, but it is a Dravya Guna. Dravya has a different meaning than a drug. Drug is different. A meaning of drug is different. Dravya has its own potential meaning. It's a beauty of the Sanskrit language that the word has its own gravity. So it's called as Dravya Guna. And while deciding the therapy, you have to use the Dravya or the combination of Dravya. Then the combination of Dravya is called as the Kalpas. In English translation nearby we can say formulations. So, while using these dravyas, also we need to consider that what Adhidaivika and Adhyatmika effect the dravya has. It is not only the organic effect. It is not only going to cure only the adhibhautik part. Even the dravyas has the potential to create the Adhidaivika and maybe to certain extent the Adhyatmika part also. It is once again a metaphysical. So, whatever the answer we do not get, we cannot just say that it is a superstition. If we are not knowing the answer, it does not mean that it is a superstition. If you see the life philosophy in this country, India, and the people of Vedic traditions, I am not going to use purposely the religious word here, I can say the Vedic traditions. There are certain rituals, there are certain festivals, and if you interestingly find, the festivals which are described or which are routinely celebrated in this particular life philosophy, like the festival like Dashera, the festival like Ganesha, the festival like Navratra, the festival like Makara Sankranti, the festival like Gudi Padwa, or there is a very big festival like Diwali. There are very many such festivals, and coming in different parts of the year, in different rutus. Some coming in the rainy season. There are 6 rutus actually. So, some coming in rainy season, some coming in the in between the summer and the winter. And interestingly, if you find the plants which are used for rituals in these festivals have the medicinal value. There is a herb which is called as Duruba, there is a herb which is called as Aghada, Apamarga. These are the herbs, these are the plants which are used in the Ganesha festival. And if you interestingly find, these particular herbs have very important medicinal value. You are all might be aware that the Duruba has a Rakta Shodhak property, it can purify the blood. Now, purify the blood is not the concept in modern medicine, this is a typical concept, purify the blood, Rakta Shodhana in ancient Indian medicine. Means the part of the year where the diseases related to blood are more prone, in that particular period, the herb Duruba is useful. If you look at one more festival, that is Sankranti. So, in this Makara Sankranti, there is climatic change starts happening in the Indian subcontinent. And there specifically the specific thing which is used is tila, combination of tila and guda. Guda is a jaggery, tila is a sesame. So, this tila is white tila actually. So, this tila and guda are taken together and are distributed. And this tila and guda has a specific medicinal value which is very important in that particular period, that is a winter season in the Indian subcontinent. So in that winter, that tila is very important because that tila has a fantastic property of prohibiting the disease like piles. It has high calcium content. The tila is very important for the joint problems. Now see how it is used. See, means the culture itself, by means of the festival, has properly imparted the medicinal system without the knowledge of people. Some people might be knowing about it, but if you tell people that no, this is useful and it is useful as a medicine, people may not take it. But when you tell that it is a ritual which is required on the Sankranti, it is a ritual which is required in Ganesha, it is a ritual which is required in Diwali, then people are going to follow it by means of the rituals. If you look at Diwali festival, it comes after the rainy season, and it is told in ancient sciences that in rainy season your digestive capacity is less, and they typically say that it is a Mandagni. Mandagni. So as a translation in English, we can say that the digestive capacity of the person is less in that specific period. So when the digestive capacity is less, it is specifically told that in that particular period you should not take a diet which is very heavy for your stomach. So it should be a light diet in that particular season. And when the rainy season ends, it's called as Varsha Rutu, Sharad Rutu, and when that season ends and when the winter starts, at that particular period, the Agni of the person will be more. So digestive capacity increases. And so as to cover this digestive capacity, so as to fulfill the hunger of that particular Agni, you require a diet which is rich, to certain, we can say heavy also. It's called as guru in ancient sciences. And we prepare the foods like laddus, we prepare the food like chakli. So these are the Indian dishes actually. You can search on internet what is meant by laddu, what is meant by chakli, what is meant by chuda, what is meant by anarsa. These are the certain Diwali dishes which are done in Indian subcontinent. And those rich food, rich with carbohydrates, rich with fats, rich with proteins, gets consumed by people and they gain their health, they regain their health. If we look at the festival of Gudi Padwa, that particular period, the people are more prone to skin diseases because the Grishma Rutu starts, the summer starts, and the herb which is used at that particular period of time is Nimba. So this Nimba herb, it is having a blood purification, action of blood purification, and it is very good for skin diseases. It is called as Krumigna. Krumigna means, if we translate it in English, we can say it has the antibacterial property. So this is Krumigna. And so as to prevent the skin infections, so as to prevent the problems which are happening because of the summer, so as to prevent the problems which can happen because of this particular Grishma Rutu. Summer it is called as Grishma Rutu. There are 6 Rutus, so it is a Grishma Rutu. So as to prevent these problems, the Nimba is used. See the cultural beauty in Indian system of medicine. It is a philosophy of life, in fact. It is not only a philosophy of medicine, it is a philosophy of life. So, such rich heritage we can see in the lifestyles also. So, if you look at the particular descriptions there in ancient Indian medicine about diseases, about other aspects of medicine, we will find Dinacharya and Ritucharya. It is very specific. Dinacharya and Ritucharya. There is no specific Ritucharya in Western medicine. We hardly see. To a certain extent, dinacharya we can see. But here there is an elaborate description about the dinacharya and the rutucharya. So, dinacharya means in whole day how you should behave. Rutucharya means in that specific rutu how should you behave. So, whenever it comes to dinacharya, at what time you should get up? What should be your schedule when you get up? What should you do when you get up in the morning? What puja you should do actually? How should you take bath? What you should eat? What you should not eat in the morning? What should be your schedule in the complete daytime when your sun comes up? You should have your food when the sun is at the peak, because that is related to your Agni, that is related to your digestive capacity. You should avoid to eat anything when the sun sets, because your digestive capacity is very less. There is more growth of the organisms, microorganisms in the food items when the sun sets. How you should sleep? How should be your bed? How should be your bedroom? How much hours you should sleep? What kind of clothes you should wear while sleeping? What kind of clothes you should wear while working? How you should sit for having food? What kind of mantras you should use or you should chant while having the food? This all have scientific. Unfortunate thing is that we cannot exactly describe it by means of parameters, because these certain aspects are metaphysical. So, a stotra which is chanted at the time of cooking food, there is one thing mentioned that while cooking the food you should chant this stotra. While before starting the food you should chant some mantras, and then you start taking the food. How should be the plate? In what direction there should be the items, the food item should be placed? What kind of food you should take while starting the food? What kind of the items you should take in between, and what type of the food items you should take at the end? You know, I just give a small example. It has been told that after the end of the food, you should take the kashaya rasa. Kashaya rasa. But interestingly, we take the madhura rasa, like fruit salads, like ice creams. This is not indicated. This is contrary to the science of the food, science of the nutrition. And these are the causes of the diseases. So you have to follow the dinacharya properly. So if you see carefully, when you approach various patients, you will definitely find that there is a problem with dinacharya. You find the people are sleeping very late, getting up very late, no exercise. The food of a substandard quality, very oily food, very sweet foods, very cold items, very spicy items, very hot items, alcohols, smoking, addictions. And when these kind of things, with these kind of problems in dinacharya are happening over a period of years, over a period of months, it is bound to cause the diseases. So the treatment will not only be the medicine. Treatment will not be only some drug or some kalpa or some formulation. The treatment will be to make the changes in the causes, make the changes in the dinacharya and eliminate the causes. If that is done, then that is the real treatment. So lifestyle modification, we call it as a lifestyle modification. But that lifestyle modification has a rich understanding in the Indian medicine. Rutucharya, what you should eat in that specific Rutu. If it is rainy season, mainly the Varsha Rutu, what we can say, what kind of food you should eat, what kind of food you should not eat, which are the diseases which can happen in case of in Varsha Rutus, and how to prevent those diseases, and what kind of achara to a certain extent we can say lifestyle, what kind of lifestyle you should follow in that specific Rutu. What kind of diseases you are more prone in the Rutu called as Vasanta, which comes just after the winter or at the end of the winter or just at the start of the summer. In that particular period, it has been told that the people are more prone to Kapha diseases. Kapha. I am going to come towards it in my further talks. So, these Kapha diseases which can happen in that particular period, and how to prevent those diseases. These are the descriptions about the Rutucharya. It is not only the Dinacharya. Means when you are seeing the patients in summer season, a physician should have the idea what is the Rutucharya in summer. So, what is Dinacharya and what is Rutucharya of that particular person? What is going wrong with the Dinacharya? What is going wrong with the Rutucharya? A person having lots of things which can increase the kapha in Vasanta Rutu, definitely it is going to cause the kapha predominant disease to the person. If the person is consuming lots of hot things, lots of ushna things in summer season, it is going to cause the pitta predominated diseases to that particular person. Means whether the person is following the Dinacharya, whether the person is following the Rutucharya, these all aspects has to be carefully analyzed, these all aspects has to be carefully seen while dealing with the patient. It is not only the diagnosis and the treatment in just a superficial way. So, there requires a counseling, there requires a thorough history, there requires that have you analyzed properly the person's dietary habits, the person's lifestyle, the person's psychological problems, the person's family problems as well, Atma, Indriya and Mana, all aspects, whether the person is really happy. If there is one thing which is called as, in Charaka Samhita it is described as Vishado Roga Vardhananam. So, there is one Sanskrit quotation, Vishado Roga Vardhananam. I will explain you the translation and some elaboration about it. Roga Vardhananam, which can increase the disease, which can increase the pathogenesis of the disease. Vishado, we can say it is a depressive state of mind, unhappy state of mind, very unhappy, not it is very unhappy state, it is a depressive state of mind. Vishado Roga Vardhananam. It does mean that if any person is not recovering, or if any person is having a severe depression or severe unhappy state of mind, he will never get rid of diseases. Roga Vardhanam. Rather, the disease will increase, whatever medicine you give. Means you need to find out what is the cause of depression, what is the cause of unhappiness. I am slightly using this altogether. Both can be taken. So, what is that particular cause? You need to find out, and we need to see whether any such familial cause is there. I find when I see the patient that now many problems which are seen in medical practice are because of the psychological stress the people are facing. Psychological stress of existence, psychological stress of finance, psychological state of maintenance of the endeavors, the stress of competition, the stress of traffic, the stress of pollution, the stress of unhealthy circumstances surrounding, the stress of work pressures, and all these stresses is leading towards various diseases, and mainly the diseases like hypertension and heart disease. It is very nicely told in ancient Indian medicine Rasavahini dushyanti chintyanam atichintanat. Whenever the person thinks a lot, atichintanat. Whenever the person has lots of stress, we can say. Or person thinks a lot about the stress. Everybody has the stress, everybody has some or other problem, but thinking too much about it. And that is the cause for rasavahini dushyanti. So there is one srotas which is called as rasava srotas. I am going to come at it in my later talks. So this Mulasthana, the root of that particular srotas is called as Rudaya. So whenever there is excessive chinta, excessive stress, excessive thinking about the stresses, that can cause the problem with the heart. Very interesting. We say now there is a heart disease epidemic. Heart disease capital of the world. So many heart disease patients. Chintyanamati chintana. Lots of stress. But if you interestingly find to the rural areas or to the tribal areas, the people of the tribal areas, you see very less incidence of the heart disease. Normally you get very less patients with hypertension, you get very less patients with the diabetes, or you get very less patients with the ischemic heart disease in tribal areas or in some rural parts of India. But in urbanization, these problems are increasing. This rural population, this tribal population, they have their own problem, the infectious disease epidemics. That is a different part. But lifestyle problems are less because the pattern with which they look at the disease, they look at the life, the aspect with which they look at the life is different. They are happy people. Whatever they get, they are happy. They are not worried about big bungalows and big cars and the financial maintenance of that. Means there are lots of psychological stresses. Because psychological stress, in the process of civilization, the way you go at the upper level or upper layer of the civilization, the stress increases. And at every level there is a stress. So this stress induced diseases. So when we say as a medical philosophy, the philosophy of medicine, we have to look at all these aspects in a philosophical point of view. There comes the role of philosophy. Then you can definitely find that such people, when they turn towards spirituality, they feel some benefit. Stress-induced problems. People turn towards spirituality. Why? Because they cannot cope up with the stress. And so as to find a solution for that, they feel that there can be some solution in spirituality. Definitely it is true. And they turn towards spirituality. One very interesting concept, as just before some time I described, that when the embryo forms, there is a role of Atman and Pancha Mahabhutas. Pancha Mahabhutas, the word Pancha Mahabhutas is very important. If you look at the modern medicine, you will not find such concept of Pancha Mahabhutas. Pancha Mahabhutas, Pancha means 5. Mahabhutas, I don't want to translate it, but to a certain extent, we can say 5 basic elements. Or 5 basic forms also, we can say that well. While describing the ancient Indian medicine, while describing Ayurveda, and while laying down the foundations of this particular science, they have given lots of importance to Pancha Mahabhutas. Not only Ayurveda, if you see the basics of the darshanas like Sankhya Darshana or even some other darshanas, you will find the concept Pancha Mahabhuta has been taken or the Pancha Mahabhuta has been described. 5 basic forms. And this concept, 5 basic forms of Pancha Mahabhuta has been adopted by Ayurveda or adopted by Indian medicine as it is from these darshanas. And the human being has been described as the part of this Pancha Mahabhutas. It's Pancha Bhautikam. Purusham evam Pancha Bhautikam. Pancha Bhautikam. Your human being is Pancha Bhautikam. So there are 5 forms, 5 universal forms which are existing in human being. We are the part of the universe. Human being is a part of universe. Human being, no doubt human being has its own identity. But this identity is within this particular universe. So the universal factors decide about the things which are happening in human body also. So when some universal change happens, that universal change can create the change in the human body. So that you can see the diurnal variations of the hormones. So at the different period of time of a day or night, there is a difference level, there are different level of hormones which are there in the body. So the levels of the hormones change. So variation. So this variation is happening because of the universal change which is happening in the surrounding. So who is responsible for this universal change? Sun. Universal in the sense related to our solar system. Even beyond our solar system is also important. So when there is day and when there is night, which is happening because of these movements of the earth around sun, movement of the earth around itself. So the day and night, or the 1 year, what we can say. So this is happening because of the movements in between sun and the earth, and as well as moon also, because moon is important. Moon has a tremendous gravitational force which is exerts on the earth. So these things have the value in deciding the physiology of human body. So the physiological changes which are happening in the human body, those physiological changes have the impact of the surroundings. So very interestingly, you find that in Indian astronomy, the moon is given importance in the calculations of time, and there is a 28-day cycle of 28 days a moon completes a month, and the same type of the thing is seen in the female body as far as the menstrual cycle is concerned. It has a close association. How these are associated? This is one more area of a big research. But at least you can say that some similarities found there. So these Pancha Mahabhutas, the Pancha Mahabhutas are named as, I will not translate it because it will be very difficult to translate this particular thing, or there are no such nearby words. Prithvi, Apa, Teja, Vayu and Akash. So Akasha, Vayu, Teja, Apa and Prithvi. This is the sequence. Now these Pancha Mahabhutas are the manifest forms of the universe. So from unmanifest to manifest, so from the state of unmanifest to come to a state of manifest state, and in this state of manifestation in the universe, as per the ancient Indian philosophy, the Pancha Mahabhutas came in between. So these 5 forms. And these 5 forms, like Prithvi, Apa, Teja, Vayu, Akasha, these forms decide the constitution of human body also. So if when you consider about human body, there is some part which is called as Prithvi, there is some part which is called as Apa, there is some part which is called as Teja, there is some part which is called as Vayu, and there is some part which is called as Akasha. So, without existence of this, the human body does not exist. All are there in maybe in different permutations and combinations, maybe in different percentage we can say. So, when you approach to a person or approach to a patient, you need to see in that particular patient, in that particular person, what is the status of Prithvi, what is the status of Apa, what is the status of Teja, what is the status of Vayu, and what is the state of Akasha. Means, when we see any disease condition, you have to consider that what kind of disturbances are happening in these 5 Mahabhutas, and to what extent percentage wise those are disturbed, and when you want to correct it, how you are going to correct it. Means if there is a increase in the Teja Mahabhuta, how are you going to correct it, which are the forms of medicines which can be useful for that increase in the Teja. When there is increase in the Apa Mahabhut, which are the medicines which can be used as far as you want to reduce that particular Mahabhuta which has increased in the body and which is causing the disease. So, considering these particular aspects of Pancha Mahabhutas, those have the applications in the human physiology, and such considerations you cannot see in modern medicine. So, that is the reason the philosophical difference happens. That is the reason every time you cannot explain the things which have been mentioned in the Indian system of medicine and how those can be described in terms of the modern medicine, because such kind of translation is difficult, because there is a conceptual difference which is happening there. When the concept is not mentioned, how are you going to describe it? So, when we call that there is Apa Mahabhuta, and when such concept is not there, when you are looking at the Apa Mahabhuta, and when you say that the Apa Mahabhuta is increased, and you want to give something which can cure or which can reduce this increased Mahabhuta Apa in that particular person, in that particular patient, then it is very difficult to describe it in modern terms, because the pharmacological understanding itself has the conceptual difference. The physiological understanding itself has the difference. Now, when such differences are existing, then it is difficult to describe in the modern terms whatever we are deciding, whatever we are describing in the Indian medicine point of view. This is one problem. We have to solve this problem, definitely, no doubt about it, and we have to find out the ways how to solve this problem. There is one more concept which is called as the guna concept, and these gunas are called as the Vinchati gunas, the 20 types of properties of dravyas. And these Vinchati gunas, the 20 properties, also have the Pancha Mahabhut considerations. So, for example, I can say Guru Laghu, Snigdha Ruksha, they are described in such way. So, while dealing with the patient, you have to see which kind of the guna, which kind of the material property. This, to a certain extent, we can say this is a material property. So, this particular guna has been affected. So, there are different gunas given for the three doshas, Vata, Pitta and Kapha. I am going to come towards it. So, this Vata, Pitta and Kapha, those are described that those have certain gunas. So if this guna, for example, ruksha, it is the guna of the property of the vayu. Ushna, this is the property of the pitta. Manda, this is the property of the kapha. Now, whenever that particular dosha, maybe vata, pitta or kapha, when that increases, by which property that particular dosha has increased? Is it the increase in the vayu which is happening because of the increase in the ruksha guna? If there is increase in the pitta which is happening because of the ushna guna, you have to consider it in the patient. Means while taking the history of the patient, while examining the patient, you have to look at the factors which can guide you that what kind of the guna effect is there. And when you find this particular guna effect, then definitely you have to find out what is the medicine you are going to use so as to nullify the effect which has happened because of that guna. Means there is ruksha guna which has been increased. Then what you are going to use so as to eliminate that ruksha guna? So there can be a snigdha guna. Means if it is the disease is happening because of the ruksha guna, then you have to use such medicine which is the snigdha property, which is of the snigdha property. For example, grita or ghee. So such guna or property considerations are very important. So when you describe the disease, when you approach the patient, you have to consider these factors also. Now just see a guna philosophy which can come to the part of physical science, that guna principles have been adopted. Those guna principles have been adopted, those are applied to doshas, those are applied to body constituents, and after applying to body constituents, after applying to doshas, those are described as the causative factors of the diseases also to a certain extent, and after describing those as the causative factors of the diseases, we are supposed to treat it by the medicines or by the lifestyle also. It should not be every time medicine only. So by means of the herbs, by means of the formulations or by means of the lifestyle, you are going to nullify those characteristics. If somebody is consuming too much ruksha food, if somebody is consuming the food which is of very ushna nature, you have to make such changes in the diet. You have to advise the patient that you reduce the quantity of the food which is ushna one, and you have to use a shita quantity, shita quality. So if somebody is having the ushna, the disease which is happening because of the ushna guna, you have to advise some shita property medicines to that particular person. So such kind of the considerations are very important, and these considerations are applied in ancient Indian medicine, and those are adopted from other sciences. Those are adopted from darshanas. Those are adopted from physical sciences, ancient physical sciences. Maybe those are adopted from the ancient astronomical sciences. It has been described in what rutu you should use that particular drug. It has been described that at what time of the day you should take out that particular herb. At what time you should exactly take out the particular parts of that particular herb which you are going to use for the medicines. Means these considerations have the applicability of Indian astronomy also. Means the various sciences have their role in defining the philosophy of medicine in ancient Indian medicine. Susurta has nicely told, Ekam Shastram Adhyano na Vidyat Shastra Nishaya When you study only one science, the Shastra Vinishya cannot happen. You cannot define the Shastra only on the basis of studying one Shastra. Tasmat bahusrutaha Shastra vijaniya chikitsaka. Means a physician should study many Shastras, bahusruta, many Shastras. And these many Shastras, as far as the Susruta's time is considered, those might be darshanas. But when this is the era of 21st century, it is not only the darshanas we are going to study. You are going to study all the sciences, even which are existing now also. There are various sciences, physical sciences, physics is there, chemistry is there, biology is there, cellular biology, molecular biology. All the sciences you should study. But a very important thing here is that though we study all these sciences, the sciences, ancient sciences, the sciences which are existing now, the Western medicine, Indian medicine, or complementary systems of medicine, whatever it is, the root of all this is in the philosophy. And all these sciences have the philosophical background, the philosophical foundations. And when you know these philosophical foundations, then you can nicely understand the particular science, and you can nicely even contribute for the development of that particular science. Thank you.